special, we are honored to be working with the World Health Organization on their 75th anniversary. Assalamu alaikum everyone. I'm Anika Tabassum Totini from Bangladesh Medical College third year, currently serving as a local officer on Research Exchange, BMSS Bangladesh, and my co-host.
Assalamu alaikum everyone.
It's
I'm
recording.
Assalamu alaikum everyone. I'm Radrik Hassan, currently studying at Shahid Sohrawardi Medical College Dental Unit third year and serving as the Training and Support Division Co-Director of BMSS Bangladesh. Now, before we begin, I have a very curious question for my host Totini. Totini, I can't help but wonder, what is the significance of this simulation and why is it so important?
No, Rad, not again. We have an event to host. But in all seriousness, this simulation is a crucial opportunity for us to come together as a global community and address some of the most pressing challenges facing global health today. Through our discussions and collaborations, we hope to develop innovative strategies and solutions to improve health outcomes around the world. And for us at the BMSS Bangladesh, this simulation is an immense source of pride. We have worked tirelessly to make this event a reality, and we're grateful for the support and participation of our esteemed guests. So let us begin this journey of exploration and discovery with a shared commitment to improving the health and well-being of all people. Thank you.
We are privileged to have with us today a distinguished panel of guests who have contributed greatly to the field of global health. Their expertise and insights will undoubtedly reach our discussions and help us develop effective strategies for improving health outcomes around the world. So, without further ado, I would like to introduce to our esteemed panel of guests. Please help me for welcoming our honorable chief guest, Dr. Shamil Uddin Ahmed Shimul sir, Honorable Member of Parliament of Chapai Nawabganj 1. Followed by, we have our guest of honor, Professor Dr. M. Lutfur Rahman sir, Vice Chancellor, Daffodil International University. Then we have our special guests, Professor Dr. Mazharul Islam sir, Line Director, Planning, Monitoring and Research, Directorate General of Health Services. We have with us today Professor M. Mostafa Zaman sir, Advisor, Research and Publication, World Health Organization, Bangladesh. Then we have Sadman Shahriar Hassan sir, Director, Aristopharma Limited. And last but not the least, Dr. Muhammad Fazler Rabi Khan sir, Head of Outreach, United Hospitals Limited. Now, I would request our President of BMSS, Dr. Maisha Maliha Binte Mamunapu,
And our Chair of WHO Simulation, Iftekhar Ahmed Saqib Bhaiya,
to accompany our honorable guests and take their respective seats on our stage. BMSS is truly grateful that this event is being organized by the direct supervision of the Honorable WHO Representative to Bangladesh, Dr. Bardon Jung Rana sir. But unfortunately, sir is out of the country and would not be able to join with us today. But sir wanted to be a part of this wonderful event so much. That is why sir sent a beautiful message to our delegates and guests. We would like to play this message for you all in this session.
Assalamu alaikum and a very good morning. Let me first apologize for not being there. Assalamu alaikum and a very good morning. Let me first apologize for not being there in person. I was very much looking forward to being there and experiencing your communication and advocacy skills and and listen to your interactive discussions in this WHO simulation event. I thank Bangladesh Medical Students Society for organizing this simulation event, and I feel honored as WHO to be able to support this interactive in this year 2023, which also marks WHO's 75th anniversary. I welcome all participants and observers to this WHO simulation conference to simulate a meeting of the World Health Assembly. The World Health Assembly is an annual global conference of member states representative to discuss improving health for all and leaving no one behind. Today, this simulation, WHA, you all will take on the role of a representative from different countries and debate, discuss, and write up motions to be voted in the context of political, social, cultural, and economical realities that define the world of global health policy and diplomacy. Here in Bangladesh, WHO has been a key partner of the government of Bangladesh since 1972 and provide technical advice and support for developing, improving the health of the country's population. WHO is committed to protecting, enhancing people's health in Bangladesh through an active partnership with government of Bangladesh and other stakeholders. WHO support at the country level is designed and delivered to offer evidence-based guidelines, norms and standards, supporting capacity building and institutional strengthening, generating evidence for informed decision-making, shaping appropriate health policies, and improving the overall delivery of health services. I wish you all a very successful simulation assembly that will give you further knowledge on global health policies and hone your skills on advocacy and leadership towards our common goal of health for all. Thank you all very much.
What a wonderful message by Sir. This event is being organized in collaboration with the Department of Public Health of Daffodil International University. We humbly thank DIU and all the respected teachers and staff for their kind support. We would like to invite on stage convener of the event, Professor Dr. ABM Alauddin Chaudhary Sir, Head, Department of Public Health, Daffodil International University, for sharing his words with us.
Honorable Chief Guest, Dr. Samiluddin Ahmed Shimun, Honorable Member of Parliament of Chapai Nawabganj 1, Guest of Honor, Professor Dr. M. Lutfur Rahman, Honorable Vice Chancellor of Daffodil International University, Honorable Special Guest, Professor Dr. Mazharul Islam, Line Director, Planning, Monitoring and Research, Directorate General of Health Services, Mr. Sadman Shahriar Hassan, Director, Aristo Pharma Limited, Mr. M.D. Fazler Rabbi Khan, Head of Outreach Unit, United Hospital Limited, and all the distinguished participants, guests, all the everyone present here, ladies and gentlemen, Assalamu alaikum, very good morning. I would like to welcome you all to the Daffodil International University. I'm very much grateful to the Bangladesh Medical Student Society for inviting me as a convener of this prestigious event, and also for collaborating with the Department of Public Health to organize this truly amazing event. So I'm very happy that a lot of medical students are here with us, and they're the future of healthcare. I think this program, this WHO Simulation 2023, is a unique opportunity to work together, to share their ideas, and to to come forward with some good plan, and that will contribute, definitely that will contribute in advancing global health. So we are looking forward for that, and I also would like to ensure that from the Department of Public Health, we are always with you. Don't stop here. We want more and more such type of program, and Department of Public Health will Department of Public Health definitely international will be always with you, and they will give support from their end. So thank you very much, and I again welcome all the participants and our honorable guests for joining this beautiful Daffodil University campus. Thank you very much.
Thank you so much, sir, for your kind words. It is my pleasure to introduce the driving force behind the Bangladesh Medical Student Society, the president of BMSS, who has led her team with passion and dedication to make this event a reality. Please join me in welcoming Dr. Maisha Maliha Binte Mamun Apu to the dais for her opening remarks.
Honorable Member of the Parliament, esteemed guests, and my dear delegates, Assalamu alaikum and a very good morning to all. I am glad that today we all have gathered here to the WHO simulation organized in collaboration by Bangladesh Medical Student Society and World Health Organization. It was once a dream that we will be doing this simulation. It was 3 years back that we dreamt of this simulation, and this dream came into reality after 3 years. It is happening today only because of you all, because without your presence, without your attendance, without your hard work, it wouldn't be possible. If I am the driving force of Bangladesh Medical Student Society, then the main pillars for whom today this simulation stands are there out there. First of all, I would like to thank Iftekhar Ahmed Saqib, our chair of WHO simulation, without whom this simulation wouldn't have taken place. Saqib is the main one. I still remember when we used to take interviews for the team of officials, I asked him, what will you do if you get selected for this post? And he said, I'll bring World Health Organization over here. And today, I am so proud of him that he actually did what he said. Along with SAPIG, there are two other pillars without whom this wouldn't have been possible as well. Our two amazing co-chairs of WHO simulation, Rahitul Al Nahian and Mashiat. Thank you so much for being there throughout this whole time of preparation. And the amazing OCs who have worked 24/7 for bringing this out. When I yesterday night, when I went through the social media, I saw your pictures of working so hard. They went back home so late, and even some of them were at Nilkhet preparing everything till late night. So thank you guys. Thank you for all your hard work. It shows that you guys are the future of this country, and if we gather together, if we have the proper determination, then definitely we can see a very bright future for Bangladesh. When people say that medical students are just like robots, they just study 24 hours a day and they are the monotonous people of the society, we are the exceptions because we are here today on a Friday morning doing this simulation and preparing for the future changes of the country. There are so many brain drains that happen every year. People leave the country because they aspire to become more capable to run the country. But over here, we have gathered to groom ourselves because external development in today's world is the main challenge. So I wish you all the best that after 2 days, 28th and 29th April, you guys will see a different new you in you. So let's see what we can do together. So thank you so much. Thank you to all our guests and all our participants for coming here. Thank you so much.
Thank you so much, Apu. That was really inspiring for all the delegates and our esteemed guests. Now, Aristopharma Limited is one of the top pharmaceuticals company in Bangladesh. The company started its journey in 1986 with the honest promise to provide quality medicines at affordable prices to the countrymen. With the continuous expansion and upgradation, it is now equipped with the most highly sophisticated and advanced facilities. BMSS would not be able to host such an event without the assistance of our respected partners who are always there to support us. BMSS is humbled to have Aristopharma Limited as the gold partner of WHO Simulation 2023. We would like to invite our special guest, Sadman Shahriar Hassan sir, Director Aristopharma Limited, to say a few words on his behalf.
Honorable guests, esteemed members of the WHO, Daffodil International University, and Bangladesh Medical Student Society, Assalamu alaikum, and a warm greetings to you all. I feel deeply honored to be here as a guest at the opening ceremony of the WHO Simulation 2023, organized by the BMSS Society, BMSS, with the support of the WHO and Daffodil International University. This event brings together young minds from all over Bangladesh to discuss health challenges we face today. In recent years, our world has been facing unprecedented health challenges ranging from the West African Ebola virus to the COVID-19 pandemic. These crises have tested the resilience of our global health systems. At times like this, it is crucial to have organizations like the WHO leading the way in responding to health emergencies and ensuring that the world's health systems are prepared for future outbreaks. The COVID-19 pandemic has shown us that we need robust health systems to respond to emerging health threats. Health systems are not just for treating patients, but also for preventing diseases, promoting health, and giving everyone access to quality health care. As a young medical professional, you have a critical role to play in building a resilient health system. You are the future of the healthcare industry, and it is essential to equip yourselves with the knowledge, skills, and tools necessary to meet the health challenges of tomorrow. Through your participation in this simulation, you will have the opportunity to develop your problem-solving and critical thinking skills, and to learn from the experiences and perspectives of your peers from around the country. By taking part in this simulation, you are not only building your own skills and knowledge, but also contributing to the broader global effort to improve health outcomes for all. Finally, I would like to commend the WHO, Daffodil International University, and Bangladesh Medical Student Society for organizing this simulation. This event demonstrates the value of teamwork by gathering young minds from across the country to tackle pressing health challenges. I would like to encourage all participants to take full advantage of this opportunity. Embrace the diversity of perspectives and experiences that you will encounter here, and use it to develop innovative solutions that can help build a more resilient health system. In conclusion, I would like to express my sincere gratitude to the organizers for allowing Aristopharma to be the gold sponsor of this event. Our commitment to health, global health, and investment in the next generation of healthcare professionals has always been a serious and inspiring journey. In 2000, Aristopharma expanded beyond Bangladesh to cope with the challenges of globalization, and today we export quality medicines to 30 countries across 5 continents. Participation in global events like this is an honor that adds to our success. On behalf of Aristopharma, I wish all participants the best of luck for the WHO Simulation 2023. I am confident that your hard work, dedication, and creativity will lead to meaningful outcomes and contribute to the broader global endeavor of building a robust and resilient health system. Thank you.
Thank you so much, sir, for your valuable words and motivating us. United Hospital Limited is a leading private healthcare provider in Bangladesh, committed to delivering the highest quality medical care to patients from all walks of life. With state-of-the-art facilities and a team of highly skilled professionals, they offer a wide range of services across multiple specialties. BMSS is honored to have United Hospital Limited as the silver sponsor of WHO Simulation 2023. I'm honored to introduce our esteemed guest, Dr. Mohammad Fazil Rabbi Khan sir, the head of outreach at United Hospital Limited. His extensive knowledge and expertise in outreach and community engagement have been instrumental in promoting public health awareness and disease prevention. We're honored to have him here today and would love to hear a few words from him.
Thank you. Dear delegates, distinguished guests, and participants, Assalamu alaikum and very good morning. It is a great honor for me to address you all today at this WHO Simulation 2023 event. As we all know, the past 2 years have been incredibly challenging for the entire world as we faced a pandemic that affects every aspect of our lives. The pandemic has taught us some valuable lessons, and it has shown us to improve important global cooperation, scientific research, and also innovation. During this simulation event, we have the opportunity to learn from the past and prepare ourselves for the future. We can discuss the way in which we can collaborate more effectively to prevent the spread of infection disease and to ensure that we are better equipped to handle any future health issues. We have witnessed the importance of scientific research and innovation during the pandemic. We have seen how vaccines were developed in record time and how new treatment were developed to help those who become infected. In the crucial that we continue to invest in scientific research and innovation so that we can be better prepared for any future health crisis. But the most important lesson we have learned during the pandemic is the importance of global cooperation. This virus shown us that we all interconnected and we must work together to overcome this crisis. We have shown how countries have been together to share knowledge, resources, and expertise, and how organizations like the WHO have played a critical role in coordinating in global efforts. We must continue to work together to ensure that we can prevent and control future pandemics. This means investing in public health infrastructure, strengthening our healthcare system, and ensuring that we have the resources we need to respond quickly and effectively. You all know United Hospital is one of the leading private hospital in Bangladesh under the umbrella of United Group, and it played a significant role in contributing to the country's response to the COVID-19 pandemic. United Hospital continued to provide essential healthcare services to these patients throughout the pandemic, including COVID-19 testing, treatment, and care. We set up a dedicated COVID-19 unit to ensure that patients with the viruses received the care they needed. We also collaborated with the Ministry of Health to train healthcare professionals on COVID-19 management, infections prevention and control, and other related topics. Overall, United Hospital played a critical role in supporting Bangladesh's response to the COVID-19 pandemic by providing healthcare services, capacity building, awareness campaign, and donation. The hospital efforts helped to mitigate the impact of the pandemic on the country's healthcare system and communities. You will happy to know that United Hospital received accreditation from the Joint Commission International JCI. You must know that JCI is a global organization that accredits healthcare organizations and hospitals based on their performance in meeting certain standards of quality and patient safety. United Hospital received JCI accreditation this month, making in the first Bangladeshi hospital brand to achieve this accreditation. The accreditation process involves an extensive evaluation of the hospital policies, procedures, and performance, including in patient care, infection control, medication management, and governance. JCI accreditation is recognized as a global standard in healthcare quality and patient safety, and achieving this accreditation demonstrates United Hospitals' commitment to providing high quality healthcare services to the patients. It also highlights the hospital's efforts to continually improve its operations and ensure patient safety. I want to thank you all participating in the WHO Simulation 2023 event. I hope that it will be a valuable experience for us, for you, and that can all take the lessons we can learn and apply them to our work going forward. Together, we can build a safer, healthier, and more equitable world for all. Good luck to all the participants, and thank you very much.
Thank you so much, sir. We're really grateful to United Hospital Limited for their kind support. Now, moving on. This event would not have been possible without the constant guidance from this one person. Sir was the first person from the WHO to hear our event, and from that point, Sir kept on constantly guiding us. BMSS is blessed to have you with us, sir. It is my pleasure now to call on stage our patron and guide in this event, Professor M. Mustafa Zaman, sir, Advisor, Research and Publication, World Health Organization, Bangladesh. We request Sir to share his valuable insights with us.
Assalamu alaikum. Chairman of today's session, Dr. Maisha, Secretary of BMSS, Saqib, respected Chief Guest, Dr. Samiluddin Ahmed, Honorable Member of the Parliament, Guest of Honor, Professor M. Lutfur Rahman, Vice Chancellor of this university, special guest, Dr. Mazharul Islam, and Dr. Fazle Rabbi Khan from United Hospital, and Sadman Chariar Hassan from Aristopharma, teachers of public health of this university sitting in front of the dais, and I have two very special persons in front of me. Without mentioning their name, it would be unfair and injustice to the whole event organizers. First is Salma Sultana, my colleague. She is the media person, communication officer in WHO. I, in fact, didn't know BMSS. She has introduced BMSS to me and exploited all the opportunities to convince me that this is very important. So I'm grateful to him, and as well as BMSS should be grateful to him. Now, today's session is on WHO simulation, but if I elaborate it a little, it's WHO World Health Assembly simulation. WHO simulation would be very wide, lot of works being done by WHO, but simulation, by simulation, we wanted to mean the simulation of the World Health Assembly. So who goes there in the assembly? I will complete almost 2 decades already completed more than 2 decades in WHO, but I have never been there. But how do I know it? We join there virtually, always. So assembly is a government issue. It's not WHO, because the assembly members are the ministers of health of all the member states of WHO. So we have 192 members in the assembly. That means 192 countries are member to the World Health Organization. So from that perspective, the guidance comes from the ministers to WHO, and WHO implements those guidance as the secretariat, as a technical agency. So WHO's presence there in the assembly itself is very minimal and headed by the Director General of WHO, which is a very, very difficult task to have to lead an assembly. And in this simulation, I have asked Sakib and others to request Dr. Bulbul to take that lead. Dr. Bulbul is also deserves special thanks. How did his name came to my mind? He participated in several meetings, so he knows how the session goes, and he knows better than we do because he was practically there. Now the assembly is coming, right? When it will start? 21, 23. Nominations are yet to be finalized, drafted, but may I request you to link BMSs to honorable ministers so that one of them can go there. If that's done, at least I can assure they will not leave the assembly for shopping and tourism. Yeah, that's what we see in the videos when we see. In one of the occasions, Bangladesh was chairing, president of the session, president of the assembly, where the framework on tobacco control was endorsed. When the president took the chair, there was no one in the Bangladesh desk to clap him. Shameful, so shameful. So keeping that in mind, they can be a good choice. Person doesn't matter, anyone from them. If that is done, we will be really, really, really glad and grateful to you and the government. Now, what do we do in the countries? So we started our journey in 1972, immediately after the independence. WHO signed an agreement with the government of Bangladesh. The then Foreign Minister Abdus Samad Azad signed the agreement with WHO. And then we started the journey, as you know. Before that, I'm preparing a report of WHO contribution to health during all these 75 years. We are celebrating 75 years now. I could hardly find anything, believe me, before 71. So then East Pakistan was totally left out from the benefits of WHO. And I'm sure from the benefits of other United agencies too. Now we can get back to 1972 because the government started collaboration with the World Health Organization and health development in the country. At the beginning, with WHO guidance and assistance, lot of visionary steps were taken. Say, take an example, the establishment of NIPSAM, establishment of the document for Bangladesh Medical Research Council, and the Nutrition Council, IPHN, and all these ideas came out of the visionary leader, the father of the nation. Heads up to him, tribute to him, because even in 1972, the leader of the government, the leader of the leader of the country could visualize the needs of the country. So WHO contributed to partnered with the government to eradicate many diseases like smallpox, polio extincted, malaria almost controlled. In very limited places, malaria is there. EPI, very successful program. So we support technically to the government, but we are not the implementer. So if you talk about WHO simulation, then it's quite big, quite gigantic task. So this simulation is for the assembly. I would like to see how our virtual virtual Director General of WHO plays the role today. With these, I would like to thank BMSS because Sakib, as someone was telling, he took an agenda to convince WHO to be a partner. Yes, he also used all the opportunities to communicate with us, and you have seen the message from the director WHO representative how seriously he took this issue. Thank you, Sakib. Thank you, Maisha, and thank you all the members of the BMSS, and thanks to the university authority. I'm so impressed by seeing the campus. First time here, and I made my mind that I will come another day to visit elaborately to work with the Department of Public Health. Thank you so much.
Thank you so much, sir, for breaking down the general idea of our event so effortlessly. Now, we owe a heartfelt gratitude to the health policymakers who work constantly to improve the health services of the People's Republic of Bangladesh. On that note, we would like to call upon our special guest, Professor Dr. Mazharul Islam, sir, Line Director, Planning, Monitoring and Research, Directorate General of Health Services, to enlighten us with a few words for the future health delegates.
Thank you and very good morning and assalamu alaikum everyone. Honorable Chairperson of today's opening ceremony, Dr. Maisha, as Chief Guest of today's occasion, Honorable Member of the Parliament of Bangladesh Government, Vice Chancellor of Daffodil Universities and other teachers of different faculty of Daffodil Universities, other special guests, especially WHO advisor and WHO others representatives, and Asto Pharma director and other distinguished participants. A very good morning to you all. It is my pleasure to be the special guest of these beautiful events here today, organized by Bangladesh Medical Students Society in collaboration with WHO. I'm really glad to see so many participants today who are enthusiastic to know regarding the WHO meeting that are held in international level. As a future health professional, it is your duty to know about all aspects of health service and health facilities. I'm sure every one of you will have a very nice experience from this event, since you will get to learn about many health problems and work out their solution. I've been working very closely with WHO, UNICEF and other uh, organization in the past few years and identified many flaws in our health system which need to be renovated. As a government official, we always try to implement new ideas and technique to our current system within our limit and allocate resources accordingly. Government body and international organizations such as WHO and UNICEF and others always work together to bring solution to this problem and generate new innovations. To demand for healthcare services in country continue to grow, especially in the aftermath of COVID-19 pandemic. As the pressure on the healthcare sector complies, the country requires significant rethinking of healthcare reform and healthcare financing. While donor funding has been a pillar of healthcare sector transformation, we hope to get their support in the future as well. Always we look forward to work with international organizations such as WHO and UNICEF and others, and student organizations such as BMSS to flourish the health sectors of our country. Lastly, I congratulate WHO and BMSS for these wonderful initiatives and wish for its success. My heartful appreciation to all the organizing committee members, especially Iftikhar Ahmed Shakib, Chair of the WHO Stimulation 2023, Dr. Maisha, and others, co-chairs, for working hard to arrange this event. I wish successful of this simulation WHO and hope for the best to continue your efforts, and we the government part always want to support you, and if we get if you feel any help from the government side, I am open to uh, give you this type of supports. Thank you very much all.
Thank you so much, sir. Now, we'd like to call upon our guest of honor of WHO Simulation. Without the constant assistance of him, we could not have arranged such a grand event. The person who gifted us the beautiful venue to host the WHO Simulation 2023, Professor Dr. M. Lutfur Rahman, sir, Vice Chancellor, Daffodil International University, to say a few words to us.
In the name of Almighty, the loving and the kind, our respected session chair, Dr. Maisha, Honorable Chief Guest, Dr. Shamil Uddin Ahmed Shimul, Honorable Member of Parliament, Sapai Nabgunj number 1, special guests, many of them we have heard already, people from industry, academy, and other areas, and especially the young and smart faces sitting here. That means the students from different medical colleges. I think we have also few students here from our newly started bachelor's program in public health. So, সবার জন্য সালাম, শুভেচ্ছা, নমস্কার, good morning. I welcome all, especially our chief guest, respected guests, people from industry, from academy, Director of Health Services, and with a special reference to Ms. Salman Sultana from World Health Organizations. So this is an arrangement, and with the initiative of our Public Health Department. I must mention the name of Professor Alauddin, who heads the department, and the other professors sitting in front of me and the students. So before I go to other areas, I thank you for organizing this August event here in Daffodil International University campus. We are honored by your presence here, dear students and doctors and our guests. Daffodil International University especially interested in academic, social responsibilities. We teach and we give degrees not only to students, but we also want to associate with the society in different and so many ways. And this is one of them. And we are proud, we are happy to host you here in our campus. And hopefully the Faculty of Public Health, I can't see the dean here, the head of the department, professors and students who are teachers who are here, hopefully we will cooperate with our honored guests. They will be working here for 2 days, today and tomorrow. So we have allotted our security services, as far as I know, our public relations, and our IT departments, they are working behind this program. So hopefully we'll be able to manage this program with honor and dignity, because these peoples are very respected peoples. They are especially respected because they look after people like us who know very little about the health and the health profession. So we hope through this program, our young minds, that is young doctors as well as the medical students, they will get good ideas about their responsibility, not only on World Health Organization simulation, but for the well-being of people, common people like us, who have very little knowledge about health. So please help us, help the people. So this is a very noble profession you are doing. So it needs the people like us who are outside this profession. We need your help, your sympathy, your cooperation, your suggestions to have a healthy life. So hopefully this profession, that is the medical professions, the doctors, they will look after this area and will create a healthy and successful nation. We have heard many things, our achievements from uh, previous presentations, and the other achievements. In 1972, we just started in all the ways. We have very little things done, but slowly under the leadership of the government, we have come to a great position now, and we can prove, and we have proved, that this Bangladesh we live in is really a very intelligent and successful nation. Many of my friends says that we are small, but we are not. Considering our population, we are very big, and we have also big responsibility also for health, for well-being. So as far as Daffodil International University is concerned, we have no medical college here because this is the regulation of the country. But we have a faculty called Allied Health Sciences who look after this particular area. This faculty includes Department of Public Health, sitting few professors here, and a very vibrant department. It is called, which one? Nutrition and Food Engineering, and pharmacy department. So we take care in this area, and we try to groom up our graduates so that they become human in their professions and they look after the people in general. And we also have outreaches to the society. For example, this department, public health, they take care not only of the department, but they have done other good things. For example, they go to our surrounding areas and help them. During dengue, they even reached the area and taught the general people how to get rid of dengue, how to protect our people from dengue. So I have also heard that they have also screened the ladies around us for breast cancer screening. So I think these professionals, the doctors, and especially these young minds, the bright and smart faces, when you will be doctor, I think you will take care of us and you will go outside your profession to help the people. This is very important. Our academic people, we are doing only routine works, teaching students, giving degrees, etc. But most of the universities have forgotten the responsibility, that is academic, social responsibilities, especially the social responsibilities. We do the academic responsibilities, but we should take part in social activities. And this, I think, holding this event here, Simulation 2023 in Daffodil International University, this is a part of our wishes, our outside activities. We host so many events like this from many departments, and we are connected with World Health Organization for so many years. So uh, I express my gratitude to Dr. Maisha, your organization, and the others who have chosen the Daffodil International University to hold this Simulation 2023 here. Through this process, our academics myself, and we are also enriched in our knowledge and about this simulation, what actually the assembly is and how it is simulated. We have heard from our honored guest. So I do not want to take more time because you will be busy with 2 days. I have seen your agenda. A lot of work you will be doing today and tomorrow. So from our side, I think those who are involved with this program, especially the public health department, other services, securities, IT, I would like to request all of you to do your best so that we can hold and complete this session and the 2 days program successfully, effectively, efficiently. So again, in the end, I will invite all of you, our respected guests from World Health Organizations, from industry, from academia, from medical colleges to visit us here, and anytime it is open. Daffodil International University is open for you. You can come for visiting, you can come for academic purposes, and you can hold events like this. Not only this, any other type of events. We are running about 40 academic programs. We have 20,000 students. And so this is really a very vibrant university. Today is Friday, is off day. And there is also a sort of influence of the Eid vacation. Still, we are not fully back in operation. So hopefully, in spite of our some limitations today, because it is Friday, our people are not fully engaged in their activities. Hopefully, we can serve these functions successfully and effectively. With these few words, I wish you success, a grand success for today and tomorrow. So thank you all. I wish you good health, happiness, peace, and prosperity. And of course, very good health for all of you. Thank you.
Thank you so much, sir, for your humble words. Now, health is just a part of the country's policy and focus areas. But we have among us someone who not only is involved in the health sector of the country, but rather is directly involved in forging the country's constitution for a better Bangladesh every day. We are very honored that our chief guest, Dr. Shamiluddin Ahmed Shimul, sir, Honorable Member of Parliament of Chapainawabganj 1, to grace our wonderful event. We would like to request Honorable Sir to say a few words for our delegates.
বিসমিল্লাহির রহমানির রহিম। আসসালামু আলাইকুম, নমস্কার, আদাব। Dear guest, dear participant, and everyone present here, my warm greetings to all you. It is a pleasure to hear today as the chief guest of this prestigious event, WHO Simulation 2023. I would like to begin thanking Bangladesh Medical Students Society for inviting me to this auspicious occasion. I am delighted to see so many young and enthusiastic minds gathered to participate in the event. I am sure that all of you have put a lot of efforts preparing for this simulation. I must appreciate your hard work and determination, which I confident will reflect in the quality of your presentation and discussion over these 2 days. WHO has been working Bangladesh since 1972 and has played a critical role in the supporting in country health sector. One of the primary areas of focus for WHO in Bangladesh has been improving access to health care for all citizens, particularly in rural and remote areas. This has involved working in the government to develop and implement politics to promote primary health care, maternal and child health, and disease prevention and control. On this 75th anniversary, World Health Organization, World Health Organization Simulation 2023 is a unique opportunity to delegates to understand, to impact WHO global health. I believe this conference will help our future for health professionals to test and refine response plans, build confidence, and improve collaboration of all which are critical to ensuring the effective and efficient response to real life of emergency. In conclusion, I wish to thank WHO and Bangladesh Medical Society for their outstanding work in the promoting global health in these beautiful premises, Daffodils International University. Thanks to Mohtasim and Saqib and WHO for inviting me. I am confident that event like this will continue to inspire, educate the next generation of the medical profession to take the positive difference in the world. এখন গণপ্রজাতন্ত্রী বাংলাদেশ সরকারের মাননীয় প্রধানমন্ত্রী জননেত্রী শেখ হাসিনা স্মার্ট বাংলাদেশ গড়া যে দৃঢ় প্রত্যয় ব্যক্ত করেছেন, আজকের যে WHO সিমুলেশন দেখে মনে হচ্ছে যে আপনাদের দ্বারাই এই মাননীয় প্রধানমন্ত্রী জননেত্রী শেখ হাসিনা যে স্মার্ট বাংলাদেশ গড়তে চাচ্ছে সেটি কিন্তু বাস্তবায়নের পথে এগিয়ে যাচ্ছে। কিছুদিন পূর্বে আমাদের এক মাননীয় অর্থমন্ত্রী উনি মারা গেছেন। উনি বলতেন যে প্রাইভেট ইউনিভার্সিটিগুলো 3 তলা একটা বিল্ডিং নিয়েছেন, 5 তলা বিল্ডিং নিয়ে একটা প্রাইভেট ইউনিভার্সিটি হয়ে যায়। মেডিকেল কলেজ হয় 1 তলা বিল্ডিংয়ে, এবং তাতে বলছিলেন যে যদি প্রাইভেট ইউনিভার্সিটি 5 তলা একটা বিল্ডিংয়ে হতে পারে তাহলে আমার কলেজগুলো কেন বিশ্ববিদ্যালয় হবে না। আজকে মনে হচ্ছে এই ড্যাফোডিলস ইন্টারন্যাশনাল ইউনিভার্সিটি যে ক্যাম্পাসে এসছে যে একটি আন্তর্জাতিক মানের একটি ইউনিভার্সিটি, এবং আজকে খুব প্রাউড ফিল করতেছি। স্যার ডাক্তার লুৎফর রহমান স্যার যে ভাইস চ্যান্সেলর, উনিও বেগম রোকেয়া যে ইউনিভার্সিটির ভাইস চ্যান্সেলর দায়িত্ব পালন করেছেন। ঢাকা ইউনিভার্সিটিতে কম্পিউটার সায়েন্স ইঞ্জিনিয়ারিং ডিপার্টমেন্টের দায়িত্ব পালন করেছেন। আছেন আমাদের মাঝে প্রফেসর ডাক্তার মাজহারুল ইসলাম, যিনি লাইন ডিরেক্টর প্ল্যানিং অ্যান্ড রিসার্চ, স্বাস্থ্য অধিদপ্তর। প্রফেসর মোস্তফা জামান স্যার আছেন ডক্টর ফাজলে রাব্বি, আন্তর্জাতিক মানের একটি হসপিটাল যেটি ইউনাইটেড হসপিটাল। আমি পেশেন্ট ইউনাইটেড হসপিটালে মোমিনুজ্জামান স্যারের। আছেন সাদমান শাহরিয়ার, আমি ওনাকে অসংখ্য ধন্যবাদ জানাই অ্যারিস্টো ফার্মাকে যে ওনারা এটি সাপোর্ট দিয়েছেন। প্রফেসর এম আলাউদ্দিন, সালমা সুলতানা অ্যান্ড সর্বোপরি চেয়ারপারসনের দায়িত্ব পালন করছেন মাইসা, ডক্টর মাইসা। আমি স্টুডেন্টদের একটা কথা বলবো, যে যেখানে যে ইউনিভার্সিটিতে পড়েন না কেন, যে মেডিকেল কলেজে পড়েন না কেন, নিজেকে নিয়ে গর্ব করবেন যে আমি এই ইনস্টিটিউটের এই জায়গার আমি স্টুডেন্ট। এটা গর্ব করবেন, অহংকার করবেন না। গর্ব করবেন কিন্তু অহংকার করবেন না। গর্ব করবেন, প্রাউড ফিল করবেন, ওই জায়গা থেকে আপনি উঠে আসবেন এবং দেখবেন যে আপনি ওই জায়গা থেকে বাংলাদেশে একটা পার্ট হয়ে গেছেন আপনি। কিন্তু আমি অবশ্য আশা করি যে যে যেখানে পড়েন না কেন, তবে নিজের জায়গাটাকে শ্রদ্ধার পাত্র, শ্রদ্ধার সাথে দেখবেন, ওই জায়গাটা এনজয় করবেন। ওই জায়গাটাতে উশৃঙ্খল ভালো না, অতি মাত্রায় মডার্ন ভালো না, কিন্তু স্মার্ট ভালো, এটা জিনিস থাকবে। অতি মাত্রা মডার্ন ভালো না, আবার বলতেছি, কিন্তু স্মার্ট ভালো। সবাই চায় যে স্মার্ট থাকতে, এবং যার ফলে মাননীয় প্রধানমন্ত্রী বলেছে স্মার্ট বাংলাদেশ, মানে আগে নিজেকে স্মার্ট করেন তারপরে স্মার্ট বাংলাদেশে যান, বাংলাদেশ কিন্তু এগিয়ে যাবে। প্রিয় উপস্থিতি, আজকে সকলকে অসংখ্য ধন্যবাদ। বিশেষ করে WHO, আমাদের যে জাতীয় সংসদে একটা চাইল্ড ককাস বলে একটা ইনস্টিটিউট আছে, যেখানকার আমরা সদস্য, বিশেষ করে যারা ডাক্তার সংসদ সদস্য আছে তিনারা, অ্যাডভোকেট সহ, সেখানেও WHO আমাদের ওখানে একটা ভালো সহযোগিতা করে, এবং যার ফলে কিন্তু WHO কিন্তু সব জায়গাতে সহযোগিতা করে। তো আমি WHO-রও সামনে দিয়ে এগিয়ে যাক এই সাফল্য কামনা করছি। আবারও সকলকে আমাকে এই ড্যাফোডিল ইন্টারন্যাশনাল ইউনিভার্সিটির জায়গায় বাংলাদেশ স্টুডেন্ট সোসাইটি যে দাওয়াত দিয়েছে প্রধান অতিথি করে, আমি মনে করি না যে ভিসি স্যারের সামনে সেই আমার যোগ্যতা আছে প্রধান অতিথি হওয়ার, তারপর এখানে এসছেন, ডেকেছেন, এই জন্য অসংখ্য অসংখ্য ধন্যবাদ জানিয়ে শেষ করছি। আল্লাহ হাফেজ। জয় বাংলা, জয় বাংলাদেশ। আসসালামু আলাইকুম।
Thank you so much, sir, for taking the time out of your busy schedule to be here with us. It is my great honor to introduce you to the visionary behind WHO Simulation 2023, Iftekhar Ahmed Sakib Bhaiya. As the chair of this momentous event, he has poured his heart and soul into bringing it to life, and I can personally attest to the incredible effort and dedication he has shown throughout this journey. Be it 3 a.m. or p.m., he kept on giving updates on the groups to make sure everything runs smoothly. Through countless meetings and discussions with the World Health Organization, he has worked tirelessly to make this event a reality. Without his leadership, creativity, and vision, we would not be here today celebrating this landmark moment in the history of the BMSS that has been serving as a non voluntary, non profitable, and non government organization. So please join me in giving a thunderous round of applause to Sakib Bhaiya, and we cannot wait to hear his insights and reflections on his journey.
Dear everyone, how would you feel when you realize that your achievement circle has been completed? How would you feel being the External Affairs General Assistant, your external goal has been accomplished? Above everything, how would you feel if you achieved all those things on your birthday? Yes, there can be no better day for me to feel this, as today is my birthday, and today is the day to see my dream, WHO Simulation 2023, being fulfilled. I have another dream. If at least one person from this simulation can be a part of the real Bangladesh delegation in the World Health Assembly, it will be the success of this conference. Dear guests and esteemed personnel of World Health Organization, let us work together to provide the platform to the youth of this country. So when did we start dreaming to represent our country in the global platform? Our respected alumni, Dr. Sauda Apu and Dr. Shajib Zaman Bhaiya, represented the Bangladesh previously in the Southeast Asia Regional Conference of WHO. As the proud worker in this non-voluntary empowering organization, I'm grateful to have the support of our alumni always. I want to thank the respected guests for their kind support, especially our chief guest, Shamil sir. স্যারের সাথে আমরা একটা হোয়াটসঅ্যাপ গ্রুপ করেছিলাম কমিউনিকেশনের জন্য, অ্যান্ড স্যারকে আমি যখন যে সময় নক দিয়েছি, স্যার একটু দেখেন এটা ঠিক আছে কিনা, স্যার আপনি আসছেন কিনা, আমি এটা বলতে পারি স্যার ইজ দ্য মোস্ট রেসপন্সিভ মেম্বার অফ পার্লামেন্ট ইন বাংলাদেশ. থ্যাংক ইউ সো মাচ স্যার ফর ইউর কাইন্ড সাপোর্ট. দেন আই উড লাইক টু থ্যাংক আওয়ার গেস্ট অফ অনার লুৎফুর রহমান স্যার. স্যারের ক্যাম্পাসে আমি নিজে এই ইভেন্টের জন্য 12 বার এসেছি. আমার যারা কোচেয়ার আছেন, অর্গানাইজিং কমিটি আছেন, তারা অ্যাটলিস্ট 20 বার এসেছে. So thank you for this hospitality, sir, and thank you for the permission. আর মাঝার স্যারকে নিয়ে আমরা কি বলবো, স্যারকে অনেক দিন ধরে আমরা বিএমএসএস এর কোনো ইভেন্টে আনার চেষ্টা করছিলাম. সো স্যার যে এখন এসেছেন আমাদের ইভেন্টে, ইটস অ্যান অনার ফর আস. থ্যাংক ইউ সো মাচ স্যার ফর ইউর কাইন্ড প্রেজেন্স. Thanks to our partners, honorable guest from United Health and honorable guest from the Aristo Pharma for their kind support. আমি দুইজনের কথা একটু স্পেসিফিক্যালি বলবো. ওয়ার্ল্ড হেলথ অর্গানাইজেশনের ডক্টর মুস্তাফা জামান স্যার যদি না থাকতেন, দিস কুড নট ইভেন হ্যাভ বিন পসিবল. সো দিস ওয়াজ আ ড্রিম টু ডু অ্যান WHO সিমুলেশন উইথ দ্য সাপোর্ট অফ WHO, অ্যান্ড স্যার যেভাবে কনস্ট্যান্ট গাইডেন্স দিয়েছেন আমাদেরকে, থ্যাংক ইউ সো মাচ স্যার. আর আরেকজনের কথা অ্যাকচুয়ালি না বললেই নয়, সালমা সুলতানা ম্যাম. সো আমি যেরকম আমার অর্গানাইজেশনে কমিউনিকেশনস এর হেড অ্যান্ড সবসময় এক্সটার্নালদেরকে ফোন দিতে থাকি, সালমা ম্যামও WHO ওই সাইটটা ডিল করেন. অ্যান্ড আমি ম্যামকে যখন রাত 11টায় 12টায় যখনই ম্যামকে আমি চেয়েছি, ম্যামকে পেয়েছি. সো থ্যাংক ইউ ফর দিস সাপোর্ট ম্যাম, আদারওয়াইজ ইট উড নেভার হ্যাভ বিন পসিবল. থ্যাংক ইউ সো মাচ ম্যাম. দেন আমি আমাদের রিসপেক্টেড অ্যালুমনাই ডক্টর ওমর খাইয়ুম রাফি ভাইয়াকে থ্যাংক ইউ দিব. মানে ওনার মতো অ্যালুমনাই যে আমরা পেয়েছি, থ্যাংক ইউ ভাইয়া ফর অল ইয়োর সাপোর্ট. অ্যান্ড ভাইয়া অ্যাকচুয়ালি ডিপার্টমেন্ট অফ পাবলিক হেলথের লেকচারার. সো আমরা ডেফিনেটলি ড্যাফোডিল ইউনিভার্সিটিতে আরো অনেক ইনিশিয়েটিভ নিয়ে আসবো ভাইয়া থ্রুতে. আর আমি স্পেশালি দুইজন স্যারকে থ্যাংক ইউ না দিলে হবেই না. হেড অফ দ্য ডিপার্টমেন্ট অফ ড্যাফোডিল ইন্টারন্যাশনাল ইউনিভার্সিটি আলাউদ্দিন স্যার অ্যান্ড ডক্টর সালামাত স্যার. মানে টিচাররা যে কতটা হার্ড ওয়ার্কিং এন্ড হাম্বল হতে পারে আমি না দেখলে, আমরা যখনই ভেনুতে এসেছি, স্যাররা গতকালকে রাত 9টা পর্যন্ত স্যার আমাদের সাথে ছিলেন, যে আমরা যে আজকে ইভেন্টটা করতে পারছি। সো স্যার, থ্যাংক ইউ ফর ইউর কাইন্ড সাপোর্ট। সো আমরা এক্সপেক্ট করতে পারি যে এবার আমরা WHO সিমুলেশন 2023 দিয়ে একটা লিগ্যাসি ক্রিয়েট করেছি। সো সবাই একসাথে আবার ইনশাআল্লাহ আমরা WHO সিমুলেশন 2024 ও অর্গানাইজ করব। So I want to thank our partners. Firstly, our organizer of this conference, Department of Public Health, Daffodil International University. Our gold partner, Aristopharma Limited. Our silver partner, United Hospital Limited, Incepta Pharmaceuticals. Our bronze partner, Square Group. Our refreshment partner, Acme. Nutrition partner, Can Nutrition. Tea partner, Kazi and Kazi. Ice cream partner, Bellissimo. Snacks partner, Well Food. Lunch partner, Fries & Co. Game partner, Astrocade. Dessert partner La Delicia, radio partner ABC Radio, print media partner Shomokal and Shout the Daily Star, broadcast media partner Asian TV, and stall partner Harmony Trust Limited. এই কনফারেন্সটা এত বড় হতো না যদি আমাদের 30টা আদার ডিফারেন্ট পার্টনার্স না থাকতো। সো থ্যাংক ইউ ফর ইউর কাইন্ড সাপোর্ট। আর আমি এখন একটা কোট বলতে চাই, অ্যাজ দ্য কোট বাই ওয়াল্ট ডিজনি গোজ, অল আওয়ার ড্রিমস ক্যান কাম ট্রু ইফ উই হ্যাভ দ্য কারেজ টু পারসু দেম। I had that dream, but my organizing committee fulfilled my dream. Dear guests and participants, let me introduce my organizing committee of WHO Simulation 2023. And when I will call your name, please come to the stage and take your position in the stage. We will click a group picture with our guests. Introducing the finance and externals team, exceedingly good working team. At the head of the team, we have Shirazum Munira Parsa. As the member, we have Muntazima Tawaddul. Please, everyone come in front. Everyone, as I call your name, please come in front. Member Muntazima Tawaddul, Fokrul Alom Neon, Radrik Hassan, Mutasim Islam, Nishat Tasnim Ifti. In the plenary team, we had our head Susan Afrin Appu, members Anika Tabassum Totini, Tanisha Ahmed, Khondakar Rashki Tasnim, Montasir Tousif, Munsefa Afroz Disha. In the PR and SM, our PR wonder persons, I should say. It is headed by the PR wonder herself, the Queen Shanjida Hossan Apu, Meherunnesa Silki Apu, and member Kamrunnesa Alom Uzma, Oniket Shaha Shodip, Fardos Salehin Faisal, Fatema Batul, Shinjan Shoili, Tasnin Adiba, Takwa Mohiuddin. In the delegate affairs team, we had our head, Janatul Ferdos Elma Apu, and our extremely hardworking members. এই যে এত ডেলিগেশন দেখতেছেন পুটালটাই ডেলিগেশন টিমের। সো সুভা তানজিম, নাদিয়া ইসলাম, আকিলা তাহসিন, ফারহানা জামান রাইসা, রেদওয়ান তানভীর সিয়াম। In the logistics, we had the beautiful logistics that you saw. Mohammad bin Amir, MD Mohammad bin Amir Bhaiya as the head, member MD Asif Umar Patwari, Shantija Mozahid Choudhury Apu, Shams Sharia Rafid, Alif Mahmoud Okhor, and Tamim Nahid Yushorjo. And hospitality team, এই যে বাস থেকে শুরু করে কালকে রাত 12টা পর্যন্ত ওরা বাইরে ছিল। সো হেড আব্দুল্লাহ অমিও, মেম্বার মাহিমা বিনতে মালিক, গাজী বিস্ময় নুসবা, সায়ন্ত মোহাম্মদ শওকত, হাসিবুল হোসেন, তাসনিম হোসেন। সোশ্যালস অ্যান্ড ফটোগ্রাফি, আওয়ার লাস্ট টিম, হেড সংবর্তিকা বন্দ্যোপাধ্যায় দিদি, মেম্বার আলিশরাক সানি, বাইজা বেগ আপু, শতাব্দী কুঞ্জ অদিতি, খন্দকার আব্দুল্লাহ মিম, মাইশা ফাইরুজ। And we have also 9 other conference management officers. How can I even forget them? Samin Yasser Safayet, Samin Yasser, Shifat Hassan, Shihab Mahmoud, Numan Bashir, Mohammad Shuhaib Mir, Afifa Afroz, Humaira, and Nafisa Namni Nova. আর আমার দুইটা পার্টনার আছে। আমি যখন সিমুলেশনটা স্টার্ট করেছিলাম আমি জানতাম না যে তাদের সাথে কিভাবে কাজ করব, বিকজ বোথ অফ দেম ওয়ার মাই সিনিয়র্স। সো সিনিয়রদের সাথে কাজ করে যে এত সুন্দর একটা কনফারেন্স আমরা করতে পারি, দিস কুড নট হ্যাভ বিন নেভার পসিবল উইদাউট মাই co-chairs. I'm proud to introduce Rahitul Al Nahian Bhaiya and Mashiat Mubashir Apu as the co-chairs of this conference. So this is the biggest ever organizing committee from Bangladesh Medical Students Society, and I'm really proud as the chair of this organizing committee for having you in my team. Now I want to thank our advisors, Ragib Bhaiya, Nuha Apu, Yusha Apu, Sakir Bhaiya, and our alumni Ittiza Bhaiya for their kind support. দুইজন মানুষের কথা স্পেসিফিক্যালি মেনশন না করলেই না, that is Maisha Apu and Nadia Apu, our president Maisha Apu and my VP Nadia Apu. আমি অলওয়েজ সবসময় একটা জিনিস বিলিভ করি, ইফ ইউ গিভ মি দ্য উইংস আই উইল রিচ দ্য স্টার্স। থ্যাংকস ফর গিভিং মি দ্য উইংস অ্যান্ড থ্যাংকস ফর হেল্পিং মি ডুইং দিস। সো দিস ব্রিংস আস টু মাই স্পিচ। আমরা 2 দিন কি কি শিখবো, সবাই প্ল্যাকার্ড দেখতে পাচ্ছেন। সো ইউ আর দ্য ডেলিগেট অফ ইউর কান্ট্রি। কালকে আমরা অনেক মজা করছিলাম, ওই যে ওইখানে ইসরায়েলের 5 জন ডেলিগেট আছে। সো আমরা অনেক মজা করছিলাম যে এটা কিভাবে ইসরায়েল কিভাবে বাংলাদেশে ডেলিগেশন করে। সো দিস ইজ দ্য বিউটি অফ WHO। এখানে আমরা ওয়ার্ল্ড পলিটিক্স, গ্লোবাল হেলথ নিয়ে আমরা শিখবো, সো দ্যাট উই ক্যান অলসো ইমপ্লিমেন্ট ইট when we represent our country in the global platform. সো থ্যাংক ইউ। আমাদের যে ওপেনিং সেরিমনিটা কিছুক্ষণ পরে শেষ হবে, তারপর আমাদের প্লেনারিটা শুরু হবে। সো 2 দিন আমরা অনেক কিছু শিখবো, অনেক হার্ড ওয়ার্ক করবো, সবাই অনেক রিসার্চ করে এসেছি। সো যে কোনো প্রবলেমে ইউ হ্যাভ দিস টিম, সো ফিল ফ্রি টু কন্ট্যাক্ট দেম। থ্যাংক ইউ এভরিওয়ান। সো আমরা সবাই একটু পিকচার তুলবো স্যারদের সাথে, সবাই স্টেজে আসি। স্যার আপনারা বসেন স্যার। হ্যাঁ, পিছন থেকে। জি স্যার, পিছন থেকে সামনে বসে যাও।